The score of acute pancreatitis was left, so today we will be doing Ranson score. Ranson score is seen at two times, that is at admission and at 48 hours. For at admission, the mnemonic is Army General Law. Okay, A in the army stands for age, then G is for blood glucose, then LAW. L stands for serum LDH and A stands for serum AST, and then W stands for WBCs. Okay, and this we can remember the particular number also. A age is more than 55, then glucose is more than 200, then LDH is more than 350, AST is more than 250, and WBC is more than 16,000. 55, 200, then 350, 250, and 16,000. Then at 48 hours we see the six parameters, and it can be remembered by the mnemonic Captain Hobbs. Army General Law, and Captain is also related to army, so it can be remembered easily. Captain, C is for calcium, then H is for hematocrit fall, then O is for oxygen, B is for blood urea nitrogen, and the next B is for base deficit, and then S is for sequestration of fluids. Okay, C for calcium, H for hematocrit fall, O is for oxygen, B is for blood urea nitrogen increase, then another B is for base deficit, and S is for sequestration of fluids. So we are done with the pancreatitis. Let's revise again with the mnemonics, so we don't forget about the acute pancreatitis scores. First one we did in the previous session was Glasgow criteria. Glasgow criteria is remembered by the mnemonic pancreas. Okay, Glasgow criteria, for it is for mental status, and now it is in the pancreatitis, so we have to remember specifically related to the pancreas. Okay, so its mnemonic is pancreas. Pancreas में पी से था पार्शियल प्रेशर ऑफ ऑक्सीजन, ए से एज, एन से न्यूट्रोफिलिया, सी से कैल्शियम, आर से रीनल फंक्शन, ई से एंजाइम्स, देन ए से एल्ब्यूमिन, एंड एस से शुगर ब्लड ग्लूकोज. देन था सीटी सीवियरिटी इंडेक्स एंड पैंक्रियाटिक नेक्रोसिस. पैंक्रियाटिक नेक्रोसिस में तो सीधा ही है लेस देन 30, 30 to 50 एंड मोर देन 50. एंड बाल्थाजार स्कोर में क्या था, नॉर्मल पैंक्रियास, फिर इनलार्ज हुआ, फिर इन्फ्लेम हुआ, फिर एक पॉकेट बनी, फिर दूसरी दो से ज़्यादा पॉकेट्स फ्लूइड कलेक्शन बनी. ठीक है, सी टी सीवियरिटी इंडेक्स हो गया. देन बाइसेप. बाइसेप के लिए सेम उसी निमोनिक है. बी फॉर ब्लड यूरिया नाइट्रोजन, आई फॉर इम्पेयर्ड मेंटल स्टेटस, एस फॉर SIRS, देन ए फॉर एज, एंड पी फॉर प्लूरल इफ्यूजन. Then is Apache 2. Apache 2 is Bhagwat Nakchor, BP, heart rate, arterial pH, GCS, WBC, age, temperature, sodium, potassium, creatinine, hematocrit, oxygenation, respiratory rate. Then is Ranson's. Ranson's Army General Law and Captain Hobbs. Army General Law is age, then is glucose, then is LDH, AST, and WBC. And at 48 hours is calcium. Captain Hobbs, calcium, hematocrit, oxygenation, blood urea nitrogen, base deficit, and sequestration of fluids. More than 55, age more than 55, blood glucose more than 200, AST more than LDH is more than 350, AST is more than 250, and WBC is more than 16,000. Okay. Then we have the TNM classification. TNM classification, basically we have to remember of the two tumors that is most important in the surgery, thyroid and the breast. First of all, we will be saying TNM for the thyroid. Basically we have to remember the dimensions only. We get confused between, like, it was less than 3 centimeter, 3 to 4, 3 to 5. So this basically we need to remember. Okay, T1 is tumor less than 2 centimeter. Then T2 is 2 to 4, and T3 is more than 4. Okay, then T4 we know that extension to other neck structures. forget about this. Basically, we have to remember what is T1, T2, and T3. Size in greatest dimension. Okay, less than 2, 2 to 4, and more than 4 centimeter. Then is thyroid score. Another score for thyroid, that is TIRADS. Thyroid ra- radiological score. Okay. TIRADS 1 is normal thyroid ultrasound. TIRADS 2 is benign. Then TIRADS 3 is probably benign. TIRADS 4 is low suspicious aspect. And TIRADS 4B and 5 is high suspicious aspects. Okay, TIRADS 1 is normal, TIRADS 2 is benign, then TIRADS 3 is probably benign, and then is TIRADS 4 is low suspicious aspect, and TIRADS 5 is high suspicious aspect. Then another radiological scoring system, CORADS, for the COVID. This is also similar to that, only TIRADS. Like TIRADS 1 was benign, CORADS 1 is TIRADS 1 was normal. Okay, TIRADS 1 starting with the normal. CORADS 1 is normal. Then is CORADS 2 is abnormalities consistent with the infections other than the COVID-19. Then CORADS 3 is indeterminate. Unclear whether COVID-19 is present. CORADS 4 is high abnormalities suspicious for COVID-19. And CORADS 5 is typical COVID-19. And CORADS 6 is PCR positive. In TIRADS there was no 6, but in CORADS there is 6. CORADS 6 also. Okay. CORADS 1 is no COVID-19 suspicion, means normal findings. CORAD 2 is consistent with the other infections, and CORAD 3 is unclear. Like in this also TIRAD 3 was probably benign, पता नहीं लग रहा कि क्या है, तो इसमें भी indeterminate वाला आ गया. ठीक है, CT findings. Then CORAD 4 is suspicious of COVID-19, CORAD 5 is typical COVID-19, and CORAD 6 is PCR positive. Then another score, BIRADS is for breast. BIRADS 1 is normal findings, 2 is benign, 3 is probably benign, 4 is low risk for malignancy, 5 is high risk for malignancy, and 6 is biopsy proven malignancy. So it is very similar to the TIRADS. Like in that also, 1 was normal, 2 was benign, 3 was probably benign, 4 was low suspicion, and 5 was high suspicion. And 6 was not there. Here 6 is biopsy proven malignancy. Breast imaging, reporting, and data system. Then we have the TNM classification of the test. Okay. Here also, like thyroid only, we have to remember the basic, that T1 is word size, T2 is word size, and T3 is word size. T1 here is same as thyroid, point less than 2 centimeter. Then T2 is 2 to 5. There it was 2 to 4 in thyroid. It was 2 to 4. Here it is 2 to 5. BREAST. It is 5 numbered. No, it is 6. Sorry, we have to remember like this only. Tumor size 2 to 5, and then more than 5 is T3. Then lymph nodes also we can remember in this. T4 is extending to the skin or chest wall. Lymph nodes are N0 is no lymph nodes, N1 is ipsilateral movable axillary lymph nodes, and N2 is fixed axillary or IM lymph nodes, and then N3 is infraclavicular or supraclavicular lymph nodes. Okay, if it is axillary, then N1. If it is axillary and fixed, then N2. And if it is infraclavicular or supraclavicular, then it is N3. Then we have the Van Nuys prognostic index for DCIS. Van Nuys prognostic index for DCIS, it was once asked in the AIMS exam, so it is important. How to score this? In this we have the size, we have the grade, we have the excision margin, and patient age. In size, and 1, 2, 3 points are assigned. In size less than 15 mm, then 16 to 40 mm, and more than 40 mm. Grade is grade 1 to 2, grade 1 to 2 is with necrosis, and grade 3. Then is excision margin. Excision margin is more than 10 mm, 1 to 9 mm, and less than 1 mm. Then is patient age, more than 60, 40 to 60, and less than 40. Basically numbers we need to remember are 40 is there and 1 to 9 this. So grade is increasing and point is also increasing, size is increasing, points are increasing, but excision margin is decreasing and patient age is decreasing. And then we assign the points, and then we score the margin for radiotherapy. Okay, what score are required for the radiotherapy? For radiotherapy, if 7, and we need to see the excision margin and score. Like score is 7 and excision margin is less than 3, and its score is 8 and excision margin is less than 3, or score is 9 and excision margin is less than 5, then we need to do the radiotherapy. And if the score is more than this, more than 9, then we have to do the surgery, that is mastectomy. And if score is less than this criteria, then we have to do simple excision. Like if the score is 6, then we will do excision, and if the score is 10, then we have to do mastectomy. Okay, this score margin relation can be remembered easily. Like you have to remember the numbers 73, 83, 95. 73, 83, 95. And other numbers which you need to remember are 40 in relation to age, and 40 in relation to size, and 1 to 9 in relation to the excision margin. So that's all. We are finished with the scores and classifications important for the surgery. Thank you.